The road to rehabilitation.
Rehabilitation of a non-seeing disfigured eye with a visually appealing prosthetic eye is not just a cosmetic solution, but a key factor for successful social, occupational, and psychological well-being. Need for cosmetic rehabilitation can be either congenital or acquired. Congenital causes includes anophthalmos and microphthalmos. Acquired causes may include status post evisceration, enucleation, or exenteration. Causes of corneal opacity with nil visual potential and phthysical eye. A thorough evaluation is done before choosing an appropriate method, including detailed clinical examination and appropriate imaging in selected cases. Methods include cosmetic contact lenses. Cosmetic contact lenses type B and corneal tattooing can be considered in patients with corneal opacity, especially when anophthalmos is less than 2 mm. Inocular prosthesis is used in patients with a phthysical eye or after enucleation or evisceration. It replaces 25 to 30% of the orbital volume. These prostheses can either be prefabricated, such as scleral shell or stock shell, or custom-made prostheses. Additionally, there are exenteration prostheses which are used in patients who have undergone exenteration. A customized prosthesis is fabricated for each patient, hence it will be having a better fit, motility and color that also matches that of the other eye, giving an excellent cosmesis.
The alginate impression of the socket. An impression tray is selected according to the patient's socket size and inserted in the socket. A measured amount of alginate with 10 ml of water is mixed into a flowing paste, loaded into a 10 cc syringe and into the impression tray, which is kept ready in the patient's socket. The alginate paste fills the entire sac and starts penetrating through the holes of the tray. Once this alginate is set, the impression tray is gently removed from the eyes. A plastic tumbler is half filled with water and alginate is taken and made into a paste. The impression tray is immersed into this paste and allowed to set. Once it is set, the contents are taken out into two halves and the tray is removed. In a wax ladle, carving of wax is heated and poured into the hollow space left by the original tray and allowed to set. After 15 minutes, the halves of the alginate are opened and the set wax is taken out to form the wax mold. Carving the wax. Once the wax mold is ready, an aluminium corneal button of the fellow eye size is taken and placed on the wax model. The wax is smoothened by carving with a scalpel blade and hot flame. Once the wax model is perfect, plaster mold. Plaster of Paris and dye stone powder in a ratio 3:1 along with water is made into a paste. This paste is filled in an eye flask up to the rim. Then wax model with the corneal button is placed in the flask and allowed to set. Again, the plaster is mixed and filled into the other half of the flask. It takes about half an hour to set, and once it is set, the corneal button along with the wax is scraped out. Now the plaster is ready for acrylic casting. In a short glass, white PMMA powder is mixed with monomer liquid to form a dough. The white PMMA mixture is placed in the plaster mold and the two halves are put together and placed in the bench press so that extra plastic leaks out. This is placed in the water bath for 45 minutes at 100 degrees centigrade. Once this curing is done, the scleral shade plastic is taken out, stem of the corneal button chipped and the surface smoothened. The scleral painting is done. Clear acrylic is prepared. Once the dough is formed, the clear plastic is placed in the plaster mold. This is cured for 1 hour in 100 degrees centigrade water bath. Once the curing is done, the cast is removed. Then the shell is smoothened and polished. Now the artificial eye is ready for delivery.
Journey doesn't end with just fitting the prosthesis. Prosthesis needs to be taken care of, and yearly polishing is mandatory. The prosthesis needs to be cleaned once in 2 to 4 weeks. A protective glass made up of polycarbonate should be used to protect the normal eye at all times. So, how early is too early? In congenital anophthalmos, conservative treatment using progressively enlarging conformers should be started as early as possible within weeks after birth.
Picture
अभी बाकी है मेरे दोस्त.
Everything is not black and white. Cosmetic rehabilitation is complicated by varied problems including contracted socket, prosthesis, implant-related complications, or eyelid abnormalities. So each of these needs to be corrected with appropriate techniques and surgeries. To conclude, loss of an eye or vision is not the end. It is just a beginning of another journey. Know the options available for the best care for the patient. Thank you.